Doctors, what's it like when you get sick? Do you go to the doctor or diagnose yourself? My pediatrician once told me an amusing story about when her daughter got sick. She brought her daughter into urgent care among her co-workers and was freaking out, not sure what could be wrong with her daughter. Her co-workers looked at her and went, "You're a pediatrician." "I know, but I can't think straight." My father is a radiologist. He had been having shortness of breath and chest tightness worsening over a few months. One day, after work was done and the clinic was closed, he hopped in the CT scanner and read his own CT scan. Massively enlarged lymph nodes all through his body, lymphoma. He's alive and well after diagnosing himself with cancer years ago. The saying doctors make the worst patients is true for a reason. Most of the doctors I work with, myself included, wouldn't hesitate to diagnose ourselves, and have on many occasions. Obviously this comes with some bias, but I like to think that I'm able to tell the difference between A, "This isn't serious, I can deal," versus B, "Maybe it's time to get a real workup." On that note, I have a particular anecdote. My attending lead doctor while I'm in residency recently had an emergency appendectomy. He has a history of kidney stones, and assumed that acute right lower quadrant pain was another one. By the time he realized maybe this is a situation B, his appendix had become gangrenous. This may vary according to your country, but if I get sick I can diagnose myself in the sense that I can say, yep, this is probably X. I should do this and that test or take this or that drugs, but I cannot self-prescribe anything. I need another doctor to prescribe it for me. No pharmacy can accept a prescription with the same name for the doctor and the patient, and no clinic can accept a request for an exam. The only exception is for use in an emergency. In that case I can self-prescribe. Doc here. As a general rule, med students are hypochondriacs. Doctors are invincible. I'm a veterinarian. When my own pets get sick, I turn into a useless, crying idiot. Luckily I have good colleagues to turn to. I asked my gynecologist, who is one of several women gynecologists in her practice, where a gynecologist goes for her yearly exam. She said she goes to one of her colleagues, but most of them go to a completely different practice for their exams and stuff. Not a gynecologist or female, but I feel like if I were, I would avoid my own practice for any exams or treatment. When I worked in a gyn office I accidentally farted in my colleague's face when we were laughing about something while she was giving me a pelvic exam. Then we laughed harder and I farted more because I was laughing so hard. No regrets. You weren't the one getting ass blasted in the face by a coworker. I don't really go to the doctor except for annual checkup, labs. I do, however, self-prescribe things like eczema cream and asthma inhalers. A lot of this is driven by being a young resident, thus are not really the demographic likely to have serious health issues, and B, not really having the time to go see a doctor due to my work schedule. Many of my peers have self-diagnosed themselves with appendicitis, small bowel obstructions, pneumonia, etc., and then presented to the ED though. I've also done the same for a lot of my friends over the phone. Doctor here. 3 of my co-residents had appendicitis last year, 2 while on shift. One did his own ultrasound and wrote his H&P for the surgery team. The other kept himself NPO after midnight during an overnight shift but kept seeing patients with MIVF running. 0 post-op precautions were followed, faced with tears of joy. My friend who's a doctor for a hospital always diagnoses herself and will call out due to the fact she doesn't want to get others sick. Her colleagues are almost always the same and completely understand the reasoning. I'm not going to be into doctor stuff today. I'm sick. Well, okay, but you need a doctor's note. Pharmacist here, and it seems several people have questioned if it is legal for doctors to write prescriptions for themselves. It is legal, at least in Illinois. It may not be in other states, but there are potentially ethical issues if it is for a controlled substance or for a type of medication that is outside their normal scope of practice. I'm a dentist. I regularly tell my patients with TMJ issues how to alleviate their pain, reduce stress, cut out caffeine, sleep in literally any position other than your stomach, stop chewing gum, hold your head, neck in a proper position, actually get a night guard and wear it. I've had TMJ pain on and off for 6 years. I do all of the things I tell my patients not to do. I do them every single day and often to excess. Long story short, I diagnose myself. I don't treat myself. My friends' parents are GPs, and there are laws in the UK so you can't be formally diagnosed etc. by family members. So as a kid the parent would take them to the DRS like they have this and this, and the other doctor would just nod and prescribe medicine, haha. My ex is a doctor and this subject came up. He was terrified that he had some kind of low-symptom cancer like lymphoma, or an autoimmune issue, but he didn't want to actually get it seen about. The idea of treatment was worse to him. The knowledge of exactly what was needed to find out apparently was not comforting. I am a resident. I had a doctor's appointment and I let my attending know a week in advance. He chewed me out over email and CC'd my program director, saying that I obviously didn't take the rotation seriously. My PD was pissed. They had my back and told me to go to the appointment. The attending emailed me the next day with a forced apology. Arsehole. I may buck the trend a bit, but I tend to consider any major ailment, symptom seriously, and I usually won't hesitate to consult a colleague to get their thoughts and set up an appointment with my own primary care doctor if it's something I think needs a medical workup with blood tests and radiographic imaging. That being said, my symptoms have to be damn well serious before I even think about going to the emergency room. After you've worked there and realize some of the straight-up non-emergent nonsense people complain of, it's hard to justify checking in unless I have something I think could kill me or maim me. Actual doctor here. Oncologist. It depends on the scenario. I can prescribe myself non-controlled drugs like antibiotics, steroid creams for eczema, etc. Simple things I can self-diagnose clinically. If I need lab tests or workup I need to see someone. If my family is any example, they diagnose themselves and write prescriptions. Source: 2 doctors and 1 nurse practitioner. X420 Pussy Slayer 69X might be the funniest username ever. I couldn't believe it wasn't taken. I had to snatch it up. I'm actually a women's studies professor at Berkeley. I see a lot of variation. Some are ridiculous and have to be physically dragged to see another physician, where they sulk like a child because they're being asked all the normal questions that need to be asked when someone is ill. Some are very stoic. They know what needs to be done. They just sigh and get on with it. I think I've seen this more in physicians who get a significant diagnosis too. They know what the prognosis is and the treatment. I've only seen a small number freak out, generally refusing to get something checked because they're convinced it's something malignant. I don't think I've ever come across any hypochondriac clinicians. I hope this blows up. This is actually a good question. I've been practicing the last 14 years or so. I diagnosed my own DVT after an ankle fracture, and a year later diagnosed my own saddle pulmonary embolism. Granted, it wasn't a tough diagnosis. I was literally dying. Obviously both diagnoses required actual confirmation with imaging and I didn't manage them myself. Not in the specific spirit of the question, but when I'm talking to my patients about code status, full code is CPR, ventilator if needed, versus DNR, DNI, and they ask me what I would do, I always tell them that doctors statistically opt for far fewer heroic end-of-life measures than non-medical folks. Like was said in other comments, little stuff is no big deal, but it seems like as a group we're less aggressive in seeking care. It depends on what you mean by get sick. I'm certainly not going to see another doctor if I had a cold, but if I had an appendicitis or a lymphoma, I wouldn't have much choice, would I? If it's only a matter of a diagnosis or a simple treatment, then no, I won't bother a colleague. But if I need specialized treatment that I couldn't possibly provide to myself, then obviously. I'm very lucky that I've never had anything seriously wrong with me. However, when I do experience any symptoms, about 90% of the time I know what's going on and can determine if I need to seek out additional help. Plus I have colleagues I can bounce questions off of. Need a diagnostic test? Book an appointment. Need some medication? Book an appointment. Sometimes doctors will call in medications for each other. It's generally looked down upon, especially if they are controlled substances, but sending in antibiotics or something is relatively common. I cry to my wife, who is also a doc, and then proceed to refuse every remedy she offers me. I pretty much know what's going on with myself, but for anything that requires long-term meds, I like to have it documented so I'll go in. I have to remind myself that I can't just bump up my dose or whatever because I have a provider to do that for me, and it's disrespectful to cut her out of the loop. We'll put in lab orders or call in short-term prescriptions for each other. I called for a colleague once and the pharmacist shortly told me that he should have done it for himself as we're able to self-prescribe. In practice, though, we frown upon that. I survey my symptoms and list them, as if a PT were complaining about them to me. If I don't identify any immediately concerning red flags, I treat the symptoms myself, seeing a doc if I truly need ABX, steroids, etc., and reassess about 1 week later if not totally improved. I do have a lymph node, a few moles, and a weird bump I feel occasionally under my stomach under chronic scrutiny. When you work in medicine and go to the you will have hell to pay if it's not for a legit reason. I would sooner suture myself if possible than go to an and let them see me bleed. Truth be told, sometimes I think about faking the right symptoms to my PCP to get a total body MRI. Wife is a doctor in Canada. She works in a small practice with 5 doctors. One of them is her family physician that she will see with an official appointment, seeing as a patient and not a colleague. Everything is documented in the software. If she gets sick, you power through the day and see your patients. You can't just call in sick as you have 20 to 30 patients booked and no one to cover you. You don't get time off or sick leave. She then comes home and does charting for a couple hours and dies in bed, and does it all over again the next morning. Doctors cannot afford to be sick, financially or for their patients that will be pissed if you rebook their appointments last minute. If you're a resident, show up to work anyway. There's a saying that if you want to call out sick, you better tell them your ventilator settings. Round or be rounded on. As a doctor, I'm constantly convinced that nothing can ever go wrong with me, and also I probably have leukemia. I respond by postponing, now for several years. Wife is a surgeon. Some magic happens as soon as she's on call. No longer sick. 100% fine. Then gets sick again after her shift. It has to do with some weird space-time vortex, I believe. As the partner of a doctor, they don't do anything. Just whine. Lol. They say that doctors make the worst patients. My husband and I are both doctors. He's in family medicine, so he does everything from babies to childbirth. One day when I was a medical student and my husband a newly minted doctor in residency, I crouched down too quickly to check the output of a patient's urinary catheter, and managed to slam my vulva very hard into the corner of a chair that had been pushed behind me without me noticing. You're probably thinking, WTF? How did you do that? I too was thinking this. My team, including another medical student, a resident, and the attending, stared at me, and my patient said ow in sympathy. Rounds ended quickly and I went home, where I developed a vulvar hematoma, which is pretty much just a big goose egg like you might get with any other big bruise. Now as a med student, I knew perfectly well that the treatment for a big bruise is rice therapy, rest, ice, compression, elevation, so my husband got home that evening to find me on the bed, carefully positioned with multiple pillows like someone getting a messed up pap smear at home, icing my vulva with a bag of peas that was definitely thrown out afterwards. I pulled up an article about vulvar hematoma, which it turns out are quite common in childbirth, and read that the vast majority of them resolve within a week or two without any complications. I said great, and held out for the next 2 weeks with loose underwear and wearing a lot of dresses and skirts. 2 weeks go by and I'm still dealing with an uncomfortable lump that makes wearing underwear surprisingly frustrating. I went back to that medical article one read earlier, and continued to read where I left off. It said traumatic vulvar hematomas that occur outside of the setting of childbirth require surgical drainage about 60% of the time. So of course I called my husband in and asked him to cut my vulva open and drain the collection of blood there. He said, "What? Absolutely not. I draw the line here. No, I'm not doing that on my wife." After some coaxing and a complete lack of compromise on his end, I called up another of his fellow residents and asked for her assistance. After thinking it over for a short while, she also declined to provide such assistance, and sent me to a gynecologist. I made an appointment, and by the time it came up 2 weeks later the hematoma had resolved entirely. So it turns out that even being in the medical field and having doctor friends all around can't help you with every medical thing, although it can make the diagnosis part of things a bit simpler. With that said, I did once get a UTI, and it is lovely to be able to say this is definitely a UTI. Have someone call in medications at a pharmacy, go and pick them up for me, and bring them home without my having to be more than a few steps from the toilet the entire time. They bumble around, sick, until an exasperated nurse finally corners them and forces them to take medicine, sit down, go home. I'm a nurse. Married to a doctor. When I'm sick, it's man flu. When she's sick, it's the apocalypse. I have to force her to stay home from work sometimes when she's sick, but I have patients, patients that don't need you coughing on them and making them sick. I am a urologist. Got testicular cancer. I was shaving one day and just felt the lump down there. I immediately knew what it was, and that it needed to come out immediately. Scary how fast it showed. One day it's a normal testicle and the other, oh, there's a hard lump inside. The next day walked into the ultrasound unit to get it confirmed. Spoke to my boss who did the surgery the following day. I come from a family of doctors. I am a doctor, and I grew up knowing basically every doctor in my area. The best story I got is about a doctor we will call Graybo, perhaps one of the most senior and respected internal medicine doctors in my area. My dad is a workaholic. He loves medicine more than anything, and if he could do anything, it would likely be spending more time in the hospital. Me, not so much. Dad and Dr. Graybo were very similar in how much they love their work. Dad and Graybo over the years became good friends and had a sort of direct and cynical humor they shared with each other. At one point, my dad cracked a joke at Graybo because he again showed up to work even though he was a bit sick. Dad asked, "Hey Gray, when do you think you are going to retire? You are getting pretty old and we don't want to have to pick you up off the floor here at some point." Graybo replied, "I'll never retire. Wait. Yeah, I will. When I die." Graybo never retired. A few years later, he was driving back home from an outing with his middle-aged son and he started having a heart attack. While I assume he was experiencing the severe and horrible pain of a heart attack, he just looked over at his son and said, "I am sorry, I am having a heart attack." ... He passed away after pulling over. The man apologized to his son for having a heart attack that he was completely aware of. I can't say I would have handled that like he did.